Hey everybody, today we're talking about the common treatments that people are using for their migraines to either keep the migraines from being too intense or hopefully decreasing the frequency. There's not much done for preventing the migraines when we talk about these treatments. Now, the biggest, the most common that I see people using, one is the over-the-counter. So Tylenol or acetaminophen, ibuprofen, things like Advil, aspirin, and then naproxen. Those are the more common things. Each of those have their own side effects. In fact, anytime you add in any kind of pharmaceutical grade substance, there's typically side effects. For example, with a headache, one of the most common things we see is trying to improve the amount of serotonin into the bloodstream to help constrict blood vessels. If you're dumping a lot of serotonin into the body, just understand A plus B does not equal C in the body because everything is connected. So if you add more serotonin in, you're going to have a wide range of effects throughout the body. Things that you had no idea were connected will be affected positively or negatively because of that introduction of whatever that substance is. The body's all connected. We don't have the science now at this moment to understand everything. In fact, I would hedge to bet we don't have a majority of how the body works or the connections. Plus, everybody is different through your history, through your traumas, through your environment that you're living in. So each drug is going to interact differently with each person. Important things to understand. It doesn't mean you get off your treatment of choice or your medication. Just understand what these side effects are and what they could be doing to your body. So these over-the-counter drugs have side effects. On the low end, it might be nausea, vomiting, dizziness, skin irritation, etc. On the more severe end, though, it could be things like acute liver failure, abnormal liver, seizures, numbness, labored breathing, etc. And these are just the drugs that you get from over-the-counter without needing a prescription. If we get into the prescription drugs, the common ones we see, triptans, ergots, painkillers, or opioids, all those have significant side effects too. Opioids I really won't go down a big rabbit hole with. I think the media's done a good job as is with that. Majority, for example, of heroin users in our country today, the reason we have such a heroin problem, majority of it is due to the fact that a lot of these people got started with opioids. The majority of heroin users in America first got started with opioid medications. Now, if we go up the list to the ergots and the triptans, both of those have side effects too. And on the low end, it's numbness, it's tingling, it's lightheadedness, it's nausea, it's vomiting. Some of the common things. But on the more significant end, it's high blood pressure. It could even be low blood pressure. It could be thickening around the lung lining. It could be jaw pain, chest pain, things that mimic a heart attack or could actually be a heart attack. So it's important to understand on your end, if you're using some of these medications, what some of these side effects are and how they could be affecting your body. Again, not to say that you stop taking these treatments. To be perfectly honest with you, I don't think there's anything out there, I know there isn't anything out there that's going to cure the migraine. There's typically a predisposition to them. But what I do know and what I understand in my research and what we see clinically is if we can start to reduce some of the factors around the migraines, we can start to see a significant decrease in how those are affecting your life.